Hello, everyone, and welcome to another segment of Beyond the Script. I'm broadcasting late tonight. It's been a busy day. I want to share some things with you. I've seen patients in the clinic today, and one of my patients was very distraught. She had, a few symptoms, and I've been, treating her for a long period of time, and she, just felt more down than usual, and her, discontent and sense of not feeling good, quote unquote, was really disproportionate to what the symptoms. Whoops, I'm sorry, I was on mute on my phone. So hello again, and welcome to another episode of Beyond the Script. Sorry, my microphone was on mute. I just discovered that. So you heard the first few segments of this that was in silent film. But as I was saying, I was seeing patients in clinic today, and one of my patients um, essentially was very distraught. She was, depressed. She had been in the house during the quarantine and looking at a lot of news, and was very worried about the coronavirus episode, and it's understandable. There's a lot of news about the coronavirus, and my heart goes out to the family members of people who are ill, and also people who are ill, and of course family members who's lost loved ones. But the thing is that um, we have to put things in perspective, and I've been practicing cardiology for a long time. And I see Jenny Jones and Robert Rhodes is on. So hello, guys. The thing is that I'm accustomed to seeing patients die on a regular basis, and it's an unfortunate thing, but we have to put things into perspective. And after talking to that patient, and I shared some things with her to encourage her to do better. She, encouraged her to go out and get fresh air and sunshine, to ride a bicycle, to do things that was going to be positive for her health and also positive for her mood. But as I was talking to her, I was reflecting on an article that my older brother sent me earlier today. He, sent me an article titled "Doctors Keep Discovering New ways the coronavirus attacks the body." And so I read through the article, and of course I talked to my brother. We like to argue lots of things, politics and the like, and we have a lot of fun doing it. And he's pretty excited, or maybe tense, about this coronavirus pandemic, if you will. And I think there's some justification for that. But again, we need to put things in perspective. But what I want to do in this episode, I want to discuss some of the things that was found in this article. And the title of my talk today is going to be COVID-19 induced autoimmunity, because that's what the article dealt with. But my subtitle is that we've seen it all before. Now, the article makes it seems like, there's a big mystery as to how this coronavirus infection is working. Let's just look at it. And I'm going to read some excerpts, and I have a few slides I'm going to share with you. And I want to talk about some of the pathophysiology of infections in general and autoimmunity in general. So the article reads, today there is widespread recognition that the novel coronavirus is far more unpredictable than a simple respiratory virus, one with the potential attack from brain to toes. So what that implies is that, one, the virus, what we thought can only cause pneumonia or upper respiratory tract infection, can have a more widespread effect from head to toe. And what they've seen is that it can affect the heart, it can have blood clots, you can have effects on the kidney. But we've seen these things before. I mean, these are common processes that happen when you can have a systemic infection, whether it's a viral infection, a bacterial infection, or any other type of trigger, if you will, that can trigger the immune system. And what I want to talk to you about today is some of the things that we can see. So let me share some of my slides with you, if I can find those slides here. Share my screen. Okay, I hope you can see that. And I'm going to put this on view here. So what we're dealing with is this is a title, COVID-19 induced autoimmunity and news break. Doctors discovering new ways that coronavirus can attack the body. Here's some things that they wrote in the article. You can have strokes, you can have pink eye, unexpected blood clotting, vomiting and diarrhea, clogged and inflamed air sac, so that's the pneumonia, pulmonary embolism, that's the blood clots in the lungs. They've found a condition known as myositis, or inflammation of the heart that can weaken the heart muscle. This COVID toes, that's been in the news. You know, these purple rash we've seen it in cardiac endocarditis before. Essentially, a widespread immune system impact. Well, this bottom line here, widespread immune system impact, is really an explanation of everything else that we're seeing. And so I'm going to come off share screen. So that list of things make it seem like, whoa, there's so many different manifestations. But in medical school, you know, we were taught to be either lumpers or splitters. And the concept of being a lumper or splitter is that if you see someone that has a variety of different, you know, illnesses, you know, they come in the hospital to have something wrong with their brain and something wrong with their heart, and something wrong with their toes, and something wrong with their kidneys, something wrong. You can say, well, okay, they've got 5 or 10 different disorders, or they got one disorder that's having a systemic manifestation. And essentially, we have one disorder that's causing a systemic manifestation. Well, what we do know is that the immune system can be mistriggered, or the immune system can misfire and cause an autoimmune disease. And we see this all the time. There are diseases such as lupus, and I'll share some with you. Rheumatic fever, rather, is a common inflammatory reaction triggered by strep throat. And it has a long-term autoimmune sequelae, which consists of heart valve disease, heart muscle weakness, kidney disease, joint disease, and the like. And then many other lupus and various other diseases, rheumatoid arthritis, that can cause stroke, that can cause a weak heart, that can cause arrhythmias, can cause all of these things that we're seeing in COVID. We can also see these same type of things in acute infection. Patients that come into the hospital and they have a bacterial infection that affects the bloodstream, and it can trigger the immune system to then cause an attack. So essentially what you're having is that a bacteria, a virus, invades the body. The immune system will attack. And the immune system has to attack in an aggressive way to get rid of the infection. However, there's some things that can happen to the immune system, such that the immune system will not attack properly, or it may overreact. And I want to talk about some of those mechanisms by which the immune system can overreact. When the immune system overreacts, it can cause not only an attack against the foreign agent, but it can also cause an attack against the body itself. Now I'm going to share my screen with you. And this next slide essentially kind of got me a little bit disgruntled here, because this is a quote from the article. It says it mostly spares the young until it doesn't. And then it goes on to talk about a few rare exceptions when the virus can affect young people. The problem I have with this is that there's exception to every rule. The general rule with chronic infection, viral infections, is that it attacks older people with underlying disease. Yes, there are exceptions. Young people can die from viral infection. They can die from influenza. Young people die from cancer. Young people die from many different disease states that are typically older people disease, if you will. But when you emphasize these things, you throw it out of proportion, it throws things out of context. And so, you know, it's a problem in a sense that it makes people nervous and distraught, and it brings about much more, you know, fear than is necessary. And this can have an adverse effect on people's health. And so this was impacting my patients. And so in part, what I'm trying to get this message out is to say, let's put things in context. And I'm going to come up with some solutions. So let's talk about the autoimmune effects of, let me go to my next slide here. So this is basic autoimmunity. Now this is an important slide because it's very simple. So on the left, you have the normal immune response. You have a bacteria or virus that comes in. That's this little yellow bar here. And then you have these little immune antibodies. And these antibodies are made by the immune system, and they attack this foreign agent. This foreign agent can be a virus, bacteria, and here you have the representation of the body. Okay, so the body's normal cells are here, and notice the antibodies are not affecting the body because it recognizes the foreign, proteins here, and says you don't belong. We're going to get you out of here. However, if you look at the autoimmune disorder, notice the antibodies are not only attacking the foreign agent, but it's confusing the body's own natural tissue as foreign agent also. So this is the autoimmune. Auto meaning self, immune, the immune system is attacking itself. So Cindy says the slides are too small. Okay, Cindy. Let me know if that's better. I put it on a larger screen there. So I'll go back through this. Again, the antibodies are attacking the virus. And you see here the normal tissue is not being attacked, and the antibodies attacking the virus and the normal tissue. That's the problem there. And so I'm going to stop sharing right here, and I'm going to go back to the screen. Cindy, let me know if those slides were better with the increase on the slideshow. So again, the autoimmune is when the immune system attacks self as well as attack the foreign agent. Now, why would this happen? Well, I was discussing this with someone earlier. A healthy immune system is sort of like somebody who's driving a car that's sober. You're sober, you're awake, you're alert, and you're able to drive. But an unhealthy immune system is not only an immune system that's suppressed, but it could be disoriented as well. So for instance, if you are an unhealthy immune system, you can be so unhealthy that you are just wiped out. You just don't react at all. And those people are subject to infection, and they can have overwhelming infection, and the immune system may not do very much. That may be somebody with cancer or some other disorder that completely wipe out the immune system. Or somebody on some systemic drugs like steroids or the like. But in many cases, many people who have increased oxidative stress, and what that means, they have increased number of abnormal chemicals in their body, they can have an immune system that's disoriented. The analogy is someone who gets in a car who's drunk. If you get in a car, you are alert enough to respond to, hey, I'm Joe, or whatever, and you can already say, that I'm Joe, I'm alert enough to respond to you. But when you get behind the car and you're disoriented, you may not be able to be steady at the wheel. And if you hear a horn, it may be too loud. You may see lights. You may turn too rapidly off the road. You may turn too far left. So you're able to drive. You're awake and conscious enough to drive. But because you're disoriented, you're not going to drive very well. So instead of driving on the road, you may drive off the road. You may drive into an oncoming car and hurt somebody. That's what the autoimmune system disease is. It's a disoriented immune system. The immune system is functional. Those cells can come out and fire deadly chemicals at the foreign agent. But because the immune system is disoriented, it's like a drunk driver. It will also damage self. It will also damage the normal tissue in addition to damaging the tissue that is supposed to be fought against, such as the virus and such as the bacteria. So in the article, they talk about the fact that, it happens in some people, not in others. Well, the things that predispose to autoimmune disease is genetics can predispose to it, but also how healthy you are. We see lots of people with autoimmune disease, with lupus, we see rheumatoid arthritis, and these individuals have a genetic component, but they also have an environmental component. So let's say you have the genetic blueprint for lupus or the genetic blueprint to have an immune complex autoimmune reaction to COVID-19. It doesn't mean that you have to express either of those genetic components. It's your environment that predisposes that or expresses that gene abnormality. So what I mean by, if you have an environment of not sleeping well or smoking or drinking alcohol, eating bad food, then you will start to manifest those disease genes such as autoimmune disease or diabetes or heart disease or any other biological, physiological abnormality. When you have that, trigger to bring about the manifestation. If you have an infection or if you have some other type of stressor in your system, then you will manifest the disease. Then you'll manifest, in this case, an autoimmune response to COVID-19, or an autoimmune response to some other bacterial infection, or an autoimmune response to some other unknown trigger that we often see with people with lupus, rheumatoid arthritis, or the like. So the autoimmune response is an abnormality that's physiological and biochemical, and it's already there. The COVID-19 infection is a normal infection. We get infected with bacteria, viruses all the time. If our immune system is functioning properly, then it will fight the infection and it will protect the body. If our immune system is overreactive or disoriented, we may have autoimmune reactions all the time. There are people with autoimmune reactions all the time. People with lupus and rheumatoid arthritis, etc., they have flares all the time. And some of these flares may be associated with little small infections, viral infections that are not necessarily picked up clinically, but they have subclinical infection that triggers the autoimmune flare, and they go in to see their doctor. I'm having a lupus flare, rheumatoid arthritis flare, and they get treated for that. So autoimmune disease is something that we see a lot, and in patients in the hospital with infections, we may see extreme forms of it. They may have effects on the heart. They may have clotting factor. We call it DIC. It's fancy medical jargon, but it increased clots, it increased blood clots in the lung, stroke, etc. So this is a manifestation that we already see. So let me share some more slides. And Cindy, let me know if these other slides, let me know if the other slides are big enough. I'm going to go to my slides and I'm going to, let's see here. I'm going to do this and share my screen. Let's see here. Hopefully this is big enough. Anyway, so as I look at the next slide here, now this is an important slide. This slide is confusing on purpose. I don't want you to try to memorize all of this. I want you just to see the confusion part of this, because what I'm trying to express in this slide is the complexity of the whole matter. At the top here, you see viruses, bacteria, fungi, parasites that are infecting the body. So then you have an initial immune response. IL-6, GMS, CSF, these little factors here, these are how the cells communicate with each other. The names are not so important unless you're an immunologist or a scientist, etc. These types of cells communicate with other cells, and it creates a cascade of events that causes a section of war. So the body is very organized. And even though this slide is a little bit complex, it's an oversimplification at the same time. And so it's an important slide in the sense that it gives you a small taste of how complex your immune system is, and how delicate it is, and how important it is to properly nourish it. Now I want to switch gears here. I want to talk about oxidative stress. Oxidative stress is just a fancy phrase that we use when the body has an imbalance of toxic chemicals compared to healthy nutrients. What do I mean by that? Toxic chemicals are things like reactive oxygen species. That's a fancy medical jargon. But if you consume preservatives, or you consume rancid fats, you consume other toxic agents that get into your system, these toxic, or radiation, there are different toxic systems in different forms that gets into our system, and our body has to neutralize these agents. How do we neutralize these agents? Well, we have to have antioxidants. But antioxidants come from dark leafy greens, or dark leafy reds, or purple, and all of the fruits and veggies, all these colors in our plant foods are antioxidants. When we consume a lot of these, we build up our antioxidant stores that can in fact neutralize these reactive oxygen species. But if we don't have enough antioxidants, we have excess abnormal chemicals. So we go into what's called oxidative stress. Now, it's a fancy phrase, but don't be put off by that. Oxidative stress is an imbalance of chemicals that are bad for you compared to the chemicals that are good for you. Well, what can it affect? Well, it can affect heart. You have heart disease, blood vessel disease, immune system disease, joint disease, skin disease, GI tract, people with inflammatory bowel disease, again, oxidative stress, chronic kidney disease, oxidative stress, chronic lung disease, COPD, asthma, oxidative stress. All of these types of things create oxidative stress. Eye problems, oxidative stress, brain problems, dementia, headache, seizures, all these things can be related to excess oxidative stress. And so this imbalance. So there are many names to autoimmune disease, but really it's just one disease. And what we often do in medicine, sometimes we're splitters too much. These are fancy names: autoimmune uveitis, Sjogren's syndrome, psoriasis, multiple sclerosis, pemphigus, systemic lupus erythematosus, diabetes, Addison's disease, autoimmune hepatitis. All of these are fancy terms, but they're one common denominator, one common mechanism that manifests in different ways. And so it seems confusing, but it's not. Autoimmune disease can affect every part of the body. So what I'm trying to convey to you, when you think of COVID-19, you have to keep in mind that we have an autoimmune process, and that's why you're seeing all of these different effects. It's nothing that's out of the ordinary. It's something we've seen before, and it's something we see all the time. So it's an important concept to keep in mind. Again, triad mechanism, there's a genetic predisposition, and there's some kind of an unknown trigger. In this case, there's a known trigger, and this trigger is this trigger happens to be an infection. Oftentimes, we don't know whether it's an infection. I've had patients with autoimmune disease related to surgeries. I've done procedures on patients. We know that autoimmune diseases, autoimmune reactions can happen after bypass surgery, after catheter procedures. So there are other types of triggers of this that can happen. So it's not only just an infection. So what I want to do is kind of get to the pathophysiology, and I hope you get some understanding as to why we're seeing these things. Now, I don't want to leave you with the bad part. I want to leave you with some good news. There's good news in terms of how we can prevent this, and also how we can treat this, even in the setting of illness. I'm going to share a couple of stories with you. And unfortunately, I'm going to share a few more PowerPoint slides with you. Hopefully these slides are showing up large enough. Any suggestions on how to strengthen your autoimmune system? Let's see here. Let's see. So Valerie German, any suggestions on how to strengthen your immune system? Vitamins, I'm glad you asked, Valerie. I'm going to get to that in just a moment. That's a great question. I want all of y'all to keep that in mind. We're going to address that very soon. But I'm going to have to share some of my boring slides with you again because Valerie asked that question. Shame on Valerie. Let me see here. Okay, I am sharing. And this is an important slide. So a defined plant-based diet suppresses suppression of excessive inflammation, autoimmunity. We have shown in our clinic how you can actually suppress this. This is research that we did where we had individuals who came in, and these individuals, they didn't have COVID-19 infection, so I'll say that up front. What they had was they had hypertension and they had hyperlipidemia, and they had some other chronic illnesses. But these are individuals who had increased oxidative stress. That's the important thing to know. Now, they weren't sick, they weren't hospitalized, but these were new patients who walked into our clinic, and what we did, with 31 subjects, we put them on a raw detox diet from the Garden Kitchen. So they followed that for 30 days, and we got baseline labs here, and then we got final labs here, and we measured the change. What I want to point out to you is that what we saw in these patients were not acutely ill. We saw a significant reduction in inflammation. C-reactive protein is a molecule we measure inflammation. They had a fair amount of inflammation. It went down by over 30%. This is only in 4 weeks. Now, the p-value, for those of you who do statistics or are scientists, a p-value of 0.05 or less means that there's a significant difference between these two numbers. In other words, this change is a significant change statistically. So I'm going to highlight a couple of IL-6. IL-6 is one of many cytokines. And if you've been following the news, you've been saying, oh, there's a cytokine storm. Well, we know that a plant-based diet can reduce at least one particular cytokine by 23% in just 4 weeks. Fibrinogen, which is a molecule that we know that increased thrombosis, associated with increased stroke and heart attack, is decreased by 5.5%. The inflammatory cells, the white blood cells, neutrophils, lymphocytes, monocytes, eosinophils, basophils, all decrease by a range of 15 to 20%, 15 to almost 30% rather, and all were statistically significant. The point is simply this: with a plant-based diet, there's a decrease in inflammation, which probably correlates with a decrease in oxidative stress. And so just by eating plant foods alone, now this doesn't directly address Valerie's question, which I'm going to address in a little bit, but it's an important question in the sense that there are some things that you can do, and you can start off with an antioxidant-rich diet, which is very, very important. News break: a plant-based diet can have antiviral effects. Now, if you've been following my show for a while, and if you haven't seen it, you can go back to our channel. I had a very nice and invigorating conversation with Dr. T. Colin Campbell, and he shared with us some data from back in the 80s, I believe, 90s or 80s, and in the China study. So they had about 8,900 adults. Now, they weren't looking at coronavirus, but looking at hepatitis B virus. And what they found was that there was an association of decreased active virus when patients ate more plants. And when they also had an increase in inactive virus with more plants. So a plant-based diet shows an inactivity of viral function. So here's somewhat simplified: the antigen it goes from active virus to inactive virus. The more plants you eat and more animal protein you eat, goes from inactive virus to active virus. This is an important slide in correlation with the data I presented earlier. So you could have an antiviral effect with a plant-based diet, and you probably have you do have an anti-inflammatory effect. And these mechanisms probably working together. In other words, a nutritional antioxidant diet is probably boosting the immune system, which is probably decreasing antibody effects. So it's an important finding that we had. This is important data from Dr. T. Colin Campbell. But back to Valerie's question, the thing is that there are some vitamins that you can use. I had a conversation, a digital conversation with a colleague, Dr. Brown, who's here in Houston, well-known critical care pulmonologist, and we overlapped in training. And he's using vitamin C, thiamine, and melatonin, along with IV steroids and anticoagulants, to treat his COVID patients. And with high-dose vitamin C and high-dose thiamine, he is seeing very good results. Now, we've treated outpatients with high-dose vitamin C. We recommend vitamin D, especially if it's low, and we also add zinc, but we also do that in the context of a plant-based diet, and our patients tend to do well. I will be interviewing one of our patients who's a patient in high risk who had a coronavirus, a very elderly patient, and we put her through a detox in an outpatient setting. So stay tuned. We will be interviewing her in the next several days. But what I want to do is give the takeaway message here, which is what you want to do is boost your immune system. That's one. That's the most important. That's the cure for any viral infection, including COVID-19. Now, I hate using that word. People say cure for, but your immune system is very important. I don't care what kind of drug we have, you still need your immune system to fight this virus. The healthier your immune system is, the better your chance of fighting this virus. So what you need to do is boost your immune system. Antioxidant-rich diet, high-dose vitamin C is helpful, zinc is helpful, hydration, but fresh air and sunshine, lots of rest. All these things that are health-promoting activities are really important to boost your immune system, enhance your body's ability to suppress this virus and fight this virus. It is important to understand in general that based on testing that we've done in a number of different states, the number of people who have contracted the COVID-19 virus, there are many people who are asymptomatic, carriers who contracted the virus, defeated the virus, and are antibody positive. When they look at these numbers, even in New York State, they look at the number of people infected, you divide the number of people who died, divided by the number of people infected, the death rate is less than 1%. It's estimated in New York City to be about 0.5%, some places 0.3%. So even without a vaccine or so-called miracle drug, we know that the survival rate, even where we are now, despite how horrible this seems, is greater than 99%. Now, what drug or treatment that you know is as effective as 99% in treating any disease? Not very many, if any. So I want to, again, my heart goes out to people who've, become ill, people who've lost loved ones. It's really important, and we know death is a loss of a loved one is a horrible thing. However, we have to put this in perspective. And for those of us who are out trying to do things for our family, I want us to hold our chins up. If you have a chronic illness, if you have some other disorder that puts you at risk, don't just sit and hide under your bed. Start to do something to build your immune system. Start to do something to improve your overall health. And so these are things. So I'm getting a number of interesting questions. Any suggestions? Okay, I addressed that. Please suggest how to reduce sugar cravings. You reduce sugar cravings by detoxing. So if we have a wonderful program, I didn't mean to point this out, but online.montgomeryheart.com. Let me just post this in the comment, because if anybody wants to detox, and I'm gonna give you a couple of quick pointers here that's gonna make it simple. Online.montgomeryheart.com. So this is a new stream deal here, but I'm posting that in the chat. So those of you looking at the chat, let me just go ahead and put this on the screen here. Ooh, it's getting away from me. Put that in there, and I'll show it on Facebook as well. So online.montgomeryheart.com is our online detox program that is very helpful in terms of helping individuals with cravings. I'll post it both and back and forth on YouTube and Facebook. There was another question here I want to get to. This is a question from Cindy Goodson. Hello, Cindy. How are you doing? Do you feel masks and gloves are important, or is it stunting our ability to build up immunity? Now, you're trying to make me get controversial, Cindy. I may need to answer that offline. The point is simply this. I want you all to be good citizens and follow the recommendations of your leaders. We don't want to cause too much of commotion. What I will say is this. When I scrub in for surgery and I want to keep things sterile, I'm trying to be sterile and protect my patient. And so I have a mask to protect the patient. I have gloves to protect the patient. And conceptually, theoretically, this is what we're attempting to do. You wear a mask so that spit particles don't go out. So if I'm wearing a mask, I'm protecting you. If you wear a mask, you're protecting me. And that's the concept. And there's some people who are touting that the more masks, if everybody wear masks for 30 days, the infection rate will go down. I don't know. I'm not familiar with that data. I'll have to look at that data if that data exists. My understanding is this. It's hard to hide from a virus. It's probably impossible to hide from a virus. The infection of 70-80% of the society is inevitable. When we reach herd immunity is when we will really be protected. The way we normally kill viruses, whether it's a pandemic or not, is that a significant number of us catch it, maybe 70-80%, to where we're affecting less than 1-to-1 person, and the virus sort of dies out. And so again, if the virus gets in 80% of us and we kill it, and we no longer have it, and the other 20% of the people don't have it, you essentially have herd immunity until the next viral season comes and we get another virus. So that's important. Plant-based diets is the way to go. Yep, I agree. Let us live. Data's missing on the data. Yeah, okay. I'm not going to get controversial, Cindy, but I think you're right. But anyway, so the other thing is this. As I leave you here, and I appreciate the wonderful questions, and I appreciate all the wonderful comments. The other thing I want to do is I want you to share this information. Again, the point is the take-home message of the following. The COVID-19 infection, viral infection, is a viral infection that can be very lethal. I want to leave you at that point. However, your body's immune system is more than capable of handling it. The majority of people who are getting sick and dying from this are people who are elderly with chronic underlying diseases. It's important that you take control by improving your immune system, consume an antioxidant-rich diet, fresh air, exercise, plenty of sleep. If you have some underlying conditions or you want to be extra careful, a quality vitamin C. We have our patients consume 3 to 5 grams of a liposomal vitamin C, so liquid version. We have them consume 30 to 80 milligrams of zinc as a supplement. And we also have them supplement with vitamin D as needed to get the vitamin D levels up. But of course, fresh air and sunshine will help with that. So this is the message. Try to get this out. The news media, they have a much bigger audience, a much bigger megaphone than I have. So I rely on you guys to help spread the word, help this message go viral, because I think it's important that people understand there's some actions you can take, and I think there's things that you can do beyond wearing a mask and wearing gloves and hiding under your mattress. And hiding on a mattress is not so fun, and wearing a mask is not so fun either. But you have to do it, or you have to do it. But do something that's going to be truly effective. You got to boost your immune system, because the patient I'm going to interview later this week or early next week, wants to get all the data back. She did all the right things, but she still has some issues. So either way, we had that. But anyway, I want to thank you all for joining me tonight. And sorry it's a late night. It's probably very late at some places where you guys are. The plant-based program works, but you have to be committed to the process. That's right, Andrea D. Williams, but we need people like you to help other folks get committed. And thank you again, Valerie, and I appreciate your attention. All right, guys, I'm going to sign off. Until next time, y'all be well and help spread the good word.